Hi, I'm Mary Thomas, physical therapist in Dallas, Texas, and I have been promising people on several different social medias that I would provide you with some information on how to reduce and resolve swelling in the ankle and foot. I highly recommend that you watch the video on how to open up your lymphatic system and get the entire lymphatic system flowing before you work specifically on the ankle and foot. Why? Because the lymph system travels like an airliner, or like a highway. It does not travel like an airplane. It has to follow the paths. It has to stay on the roads. It can't just fly any place through the air like an airplane. It has to go through the paths. So if you open up your entire body's lymphatic system and get it flowing well, you're going to have much better results doing this video with how do I get the fluid in my foot flowing well and get rid of that pain in my foot that's been so chronic. I also have a video on using contrast baths. I'm holding the Cool Whip container with kind of a scowling look on my face, but that video also helps. That information also helps reduce and resolve swelling in your foot and ankle. But if you use these in combination, you will get better results because healing is not an event. Healing is a process, and processes take more than just one thing to make them work. You need to integrate body parts and different systems in order to get good results. So I know that we all want instantaneous healing. I am no different. I would love instantaneous healing. But the truth is, it takes focused steps in order to get the results you're looking for. So let's get started. I am going to make the assumption that you have seen that other video where you have opened up your entire systemic lymphatic flow. And now we're going to go into the foot and ankle. And it might take a few different camera angles. So be patient while I move my camera around a little bit. All right, so this is a bench I'm going to put my foot on so that you can see it well. Okay, so we've already opened up the leg. And so I'm just going to demonstrate that quickly again, where I'm pulling the fluid by stretching my skin on top of the tissue underneath, up and out of my leg. And it becomes very important that you've already opened up the knee and the leg before you start working on the foot and ankle. So there's your ankle bone right here. And then behind that ankle bone is a little bit of a depression, or there should be, but if you're dealing with foot and ankle pain, there may not be a depression in that area. So I want to gently stretch that skin behind the ankle bone towards my knee, going up. So the stretch is always up. I'm not making a circle, just stretching the skin up behind my ankle bone. Why? Because there's a lot of lymphatic vessels there. Now, you notice I have two hands because I'm doing the same thing on the other side of my ankle simultaneously. So I can feel that ankle bone and you can see the little pressure. I think kind of right there. Yeah, you can see it right there. So I'm doing this on both sides to help draw the fluid out of my foot. And I can literally feel my toes kind of changing and tingling a little bit as I do this to pull that fluid up and out of my ankle and toes. So then I'm going to continue to just support that fluid movement all the way up my leg. And you can see, if you remember what my calf moved like when I first started the video and just showed you a little bit of the leg, that this is already moving with greater ease and with greater movement. I'm not using more pressure. I'm really using very soft pressure. You notice the skin doesn't turn red and I'm really white. So if I use pressure, my skin turns very, very red quickly. So I also want to come in here behind the ankle at the Achilles tendon, this tendon right here, And just kind of help draw that skin going up towards my knee so that I get my ankle open. Because we want to make sure that we're opening this area so it can flow up nicely through the leg and into my body so that my organs can process all of this material that my body no longer needs in it. Okay, so most of the fluid in your foot is going to come up this direction of the arch. So I actually just use this part of my hand, the padded parts. I'm not going to dig on it with my fingers. Never dig with a lymphatic technique. So I'm going to use that movement as I roll across the bottom of my foot. So I'm bringing that movement up and rolling it. And again, I'm not digging because I'm using the broad, flat, rolling parts of my hand to bring that fluid up out of my foot. Now this little band over on this side of my foot, that's actually going to come up this direction. So I'm going to bring that around into this area. Then I'm going to come back here and do some more dragging this direction. Now, if I have swelling in my foot or pain, let's say I have pain and I look at it and I go, no, it's not swollen. The truth is it may be swollen because we can have a 30 to 50% increase in the tissue, in the fluid in the tissues before it even becomes visible. So that's like putting 18 ounces of Coke in a 12-ounce Coke can. And so to do this, even if you're like, well, I don't really think I have swelling, you might. And so to help resolve that, you want to use the body's highways of lymphatic transport. So what does the lymphatic system do? It's kind of like your garbage collectors. So from about this line, the fluid is actually going this way between the toes and up the top of the foot. Let's scoot my chair closer. So again, at about this line, everything from that line, I want to take the fluid through my toes. So if you're getting pain through this band, which is your metatarsal heads, which a lot of people talk about pain in that area, you want to take that up through your toes and in between them. Now, what do I do with my toes? The lymphatics on the toe comes down. There's vessels that come down the toe and across and into the top of the foot. So if I'm having issues with my toes, I want to come down the side of the toe and into my foot. I can also do, I call this the pie crust technique, because I'm going to go to about the middle of the toe and then I'm going to squeeze towards the edge, towards those lines. So I've got lines coming down the toe. Those are coming across the top of the foot. So I want to do little pie crust pinches on the top of that toe. And I can do it on every toe. Open up the lines down the side of the toe and then do the little pie crust pinches. When I say pinch, I mean I'm just sliding the skin along the tissue underneath. I'm not like pinching it hard. It's just a little slide, gently, like I might do on a pie crust. And guys, if you've never made a pie crust, ask your wife to help you. Or maybe watch a cooking video on pie crust. But it's a gentle little pinch that makes that flanged edge on the pie crust. So I want to do this on all 5 of my toes. And if I have a problem toe that's swollen or painful, I might spend a little extra time with that toe, right? kind of seeing when it feels good and when it doesn't. And so then I want to make sure that I'm brushing that fluid that I just got from my toes up my leg. Now this fluid is going to tend to run more heavily up the inside of the leg than it is just up the front. So I want to bring that up the side of my leg. So I usually recommend somewhere between 15 and 20 strokes in each of these areas. The truth is I rarely count. Why? Because I do it by feel. So right here in my foot, I can feel like a little tightness. And it looks like I'm just digging hard, but I'm not. I'm kind of sinking into those tissues. And as I sink into them, I'm going to do a drag. So now I'm into the muscles of the foot and just dragging any fluid out of there. So it's a little bit deeper, but I'm still, look, I'm not making the foot turn red. And obviously I have very white skin, so you would see immediately if I used heavy, hard pressure, because I turn bright red if I use heavy, hard pressure on my skin. Okay, so after I've done that for a few minutes, then I just want to do some movements with my foot. I like to use alphabet letters. Why? Because when you do the whole alphabet as big as you're able to, not only are you engaging all the different muscles of your foot to help squeeze fluid out of it, but you're also mobilizing the joints, and you are strengthening some of those muscles in the foot. Our feet, typically we put them in very structured, very heavy duty shoes, or we put them in terrible shoes, but either way, we put so much stress on our feet and we don't think about it until we have a lot of pain. And just an FYI, one of my favorite essential oils to use on my feet is peppermint, and a combination of peppermint and lime, just because it stimulates the circulation and makes them feel really nice and cool and refreshed, and it reduces inflammation. So check out my other videos on strengthening your feet using contrast baths, and check out the Body Power System, which is BODI, to help you learn how you can support your feet better. Like and subscribe to the YouTube channel. That's Move, the number 2, Improve 750. I'm Mary Thomas, physical therapist and developer of the Body Power System.